Hi, my name is Dr. Karl Yousef, and I'm here to break down what to expect in the emergency department when you come in with high blood pressure. I'll walk you through certain things your doctor may be thinking about, and afterwards, I'll explain certain labs or imaging that you might receive. Depending on the complaint, we'll finish with some potential outcomes to expect if your doctor sends you home. Remember, in the emergency department, we don't just look for what is going on, we look for what isn't going on. What does this mean? It means that as emergency doctors, we always have a mental list of scary diagnoses that we have to make sure are not happening to you. So, even if we don't find the exact diagnosis within one ER visit, our goal is always to rule out big, bad, and scary things. As you go through your workup, remember that even if you don't see your doctor for some time, they are always following your results in the background. So, you're coming into the emergency room with high blood pressure. Having high blood pressure can be a stressful experience. Usually, your doctor will first speak with you and attempt to identify what could be causing your pressure to be elevated. This can be anything from just a normal elevation in blood pressure to issues with the brain, heart, or other organs. It could also be due to infection. Also, high blood pressure on its own can have dangerous effects on the brain, heart, and other organs. Now, please don't let this scare you. I'm just going over possible issues. Your doctor will speak with you and examine you and may or may not order blood work or an EKG depending on your situation. Oftentimes, high blood pressure on its own can be a simple fluctuation within your vital signs and may not require aggressive management. Additionally, it could also be that your medications are not controlling your blood pressure effectively. Overall, your doctor will give you recommendations on the best next step for you. Remember, if your blood pressure is very high, your doctor may only lower it slightly or may wait for it to decrease on its own. This is because aggressive lowering of blood pressure can cause decreased blood flow to the brain or kidneys, potentially leading to strokes or kidney injury. This happens because the brain and kidneys may be used to a certain level of pressure, so we can't lower the pressure too much or too fast unless there is another emergent condition going on. After some time, your doctor will explain your results to you. If your doctor is recommending that you stay in the hospital, it could be for additional monitoring, or it could be that your doctor found something that needs extra attention. In either case, your doctor will explain to you the reason for keeping you in the hospital. Finally, if your symptoms improve and you're being sent home, I'm happy to hear that. Make sure to follow your doctor's recommendations, and if your symptoms are not improving or are getting worse at home, we always encourage you to come back to the emergency department to make sure nothing was missed on the first visit. Your doctor will very likely instruct you to follow up with your primary doctor. This is because they want someone to follow your blood pressure over time and adjust your medications appropriately. Sometimes, your ER doctor may not have the chance to tell you this since the emergency room is a very fast-paced environment. So please listen up to this next section. Us doctors see elevated blood pressure all of the time. And although there can be many causes, often high blood pressure is a sign that there needs to be significant changes in your diet and exercise. Medications alone are more of a band-aid and are not the cure to high blood pressure. This is why someone can keep getting more and more medications and not see significant results. It can be tough, but increasing your physical activity is a must. Even if you start by walking half a mile or 1 mile each day, it can have a significant impact. And please realize that your regular walking at work or elsewhere is usually not sufficient for physical activity. Next, you can try looking into a plant-based diet. Please feel free to search this on Google. A plant-based diet is composed mostly of fruits, vegetables, legumes, and nuts. A large component of this diet is actually removing processed foods. What are processed foods? They are essentially foods with more than one ingredient. These are your sodas, chips, microwave-ready quick meals, pizzas, and nearly all fast foods. This even includes processed meats such as hams, salami, and other deli meats. Why are these foods dangerous? This is because these foods keep your body in a state of inflammation and, over time, lead to blood vessel damage and elevated blood pressure. Now, if you disagree with the above, that's okay. Just take the main point of increasing physical activity and trying to eat a more clean diet than before. It will make a big difference in your fight against high blood pressure. Lastly, if you smoke, it needs to stop. Please speak with your primary doctor if you need extra help. You will not win your fight against high blood pressure with all of the toxins in cigarette smoke. I know that being in the emergency department can be an incredibly stressful experience, and I hope this is helpful for you. Again, this is Dr. Karl Yousef. Wherever you are, we care about you. We work hard to make sure that you're okay. While you wait, feel free to subscribe to this channel for more medical information from a board-certified emergency doctor. You can comment with video ideas that you want me to cover, and I'll take the time to reply to you. You can even watch some of the other videos on this channel for entertainment. Thank you for your time. I'm wishing you the best in your health.